we'll be delving deeper into the critical issue that affects us all: the rights and dignity of patients in Nigerian healthcare facilities. A recent viral video exposed the shocking treatment of accident victims at the Federal Medical Center, Jabi, sparking widespread outrage and calls for accountability. The incident raises fundamental questions about the quality of care, empathy, and professionalism in our healthcare system. Were the healthcare workers' actions justified? That is a big question. What are patients' rights in emergency situations? Do you know your rights when it comes to emergency situations in healthcare facilities and hospitals? How can we ensure that healthcare providers prioritize empathy and dignity? Do they treat you with enough empathy and dignity? Do they see you as human beings that you are? Joining me is Ogaga Ediru, a renowned legal practitioner, health law scholar, and a researcher. Thank you for joining us here today.
It's a pleasure.
And with him, we'll explore the legal and ethical implications of this incident and discuss ways to improve patient care in Nigeria. Thank you very much again, and thank you for joining us.
Thank you.
All right, this particular issue, especially the video that has gone around, it is quite heartbreaking, and that is just one incident that has been seen right on a video and that's been shown to the world. What of other situations? The question is, do you think that the workers' actions were justified due to the fact that they were complaining, okay, they don't have enough manpower and they could not get the patient in and treat them? They could not even take the patient out of the car and into the hospital. So with that neglect, do you think that their actions were justified?
Well, it's a bit difficult to choose sides at this point. However, it's an obligation for healthcare providers as well as healthcare establishments to treat patients in emergency situations. And it's patients' rights as well to be treated in emergency situations, irrespective of whether they can afford that treatment or irrespective of the law enforcement requirements. And so, on the one hand, these health facilities are supposed to provide such emergency treatments. It's an obligation on them.
All right, in layman's terms, so that every Nigerian should understand and know their rights, what are the laws governing, that particular situation whereby a healthcare practitioner is required to take care of a patient when they're at the hospital or they see them in dire need of health care assistance?
Yes, the National Health Act that came into force 2014. Yes, Section 20 of that Act states that healthcare providers and healthcare establishments must, it's a duty, they must provide emergency healthcare to patients brought to them. And the funny part of it is that it's also a criminal provision attached.
All right.
Yes.
So what are the consequences of not, providing immediate assistance or healthcare to, a patient as a healthcare practitioner?
Yes, subsection 2 of that Section 20 of the National Health Act makes it a crime for any healthcare provider who fails to provide emergency treatment. In fact, it carries with it a sentence, if found guilty, a 6-month jail term sentence, as well as a fine of 600,000 naira.
Oh, wow.
Yeah, or both.
So is it the fact that most practitioners do not know about the laws and the consequences that comes after that, or is it that they're banking on Nigerians not knowing their rights when it comes to these particular issues?
I would say it's both, because I don't think there's enough sensitization going around in the healthcare space, especially in healthcare facilities. Yes. And I think it's the duty of the Health Ethics Committee of every health facility to educate its staffs with regards their duties and their obligations.
And then how are Nigerians supposed to know their rights when it comes to them receiving healthcare in any medical facility?
Yes, we have what we call the Patient Bill of Rights. Yes, it's brought into existence by the Federal Ministry of Health and the Federal Consumer Protection Commission. It's an illustrated guide that provides you with patients' rights. It provides you with patient responsibilities, as well as practitioners' obligations.
Okay. So what are a couple of things in those guides that you think Nigerians should know about their rights?
Well, I'll talk on a few of these rights.
Okay.
Yes. Mainly is the right to informed consent. And every Nigerian, every Nigerian, has the right to demand from the healthcare provider the nature of the treatment that is proposed, the accompanying risks of the treatment, any alternative to the treatment, the consequences of the treatment. And he also has the right to either consent to or refuse such treatment.
But then there's this particular thing that actually does go on. You would see that some patients do visit hospitals. They would visit the doctor, and the doctor would have a diagnosis, but at the end of the day, when that patient comes out and when you ask them of their doctor's visit and the diagnosis, they would tell you that they don't know. They would tell you that the doctor just gave them, a prescription or something like that without fully informing them of what is going on. So what are your thoughts on that?
Well, this again has to do with the healthcare facilities. The healthcare facilities are obligated. Section 23 of the National Health Act obligates healthcare practitioners as well as healthcare facilities to ensure that the nature of the treatments and everything surrounding the treatments are explained to patients in a language they understand. And so it's the right of the patient to know. But because most healthcare professionals are burdened with work and they might see it's a waste of time trying to educate the patient on the various aspects of his treatment, they just go on with the treatment without informing the patient. But it's also detrimental. Yes, if an injury occurs, then the healthcare professional may either be professionally liable and may also pay damages, as well as the healthcare facility, to the injured patient. So, like you said, most patients are not aware. And it's the duty of the Federal Ministry of Health, the state ministries, and local government health authorities to educate the patients on their rights.
All right.
Yeah.
Well, we spoke about the patient's rights in emergency situations. You would see a case where someone is taken to the hospital and that person is in dire need of medical assistance, but at some point they would tell them that they would have to make some sort of payment before that person is being seen or, checked upon to see if they're okay. A payment has to be made. What are your thoughts on that, and how is someone supposed to carry on with that if it is an emergency situation?
It's simple. You go to a hospital in an emergency situation, the hospital should render emergency care, irrespective
before payment.
Before payment.
And that is just their right.
That is just their right. It's the right of every Nigerian citizen. And it's the duty of the hospitals to do that. So, irrespective of whether you can afford, they carry on treatments. There are other ways to get payment after
But what
treatment.
if you go to the hospital and that has been done? What can someone do about that to ensure that they do get treatment? And if they still don't get treatment, what other avenues can someone go through? Because at the end of the day, sometimes people do lose their lives. And what other route can someone go through to make sure that they get what's rightfully towards them, their rights?
Yeah, well, it's mandatory on hospitals or healthcare facilities to have procedure for lodging complaints. Okay? So you could lodge a complaint. However, because of the dire situation of emergencies, it may lead to fatal consequences. For example, death of the patient, just as has been seen in many videos, you know. And you could actually sue the healthcare facility.
And I actually want a bit more details on that. In Nigeria, are there a lot of cases of, individuals suing medical facilities and hospitals?
Unfortunately, there's a dearth of cases. There are hardly cases where Nigerians sue hospitals.
And do you believe it is due to the fact that they do not know their rights, or it's just the fact that every Nigerian goes with the notion that it just happens and that's God's will?
Well, it's a blend of both. Yes. Most Nigerians don't know their rights. Yes. So it behoves on the government, it beholds on civil societies, it beholds on healthcare institutions to educate citizens of their rights.
Right.
Yes.
So we've seen a lot of cases of maltreatment, neglect, and leaving people with no ounce or shred of dignity. How can we ensure that healthcare providers prioritize empathy and dignity? Because in itself, the medical field is empathy is part of that practice. So how can we make sure that our healthcare providers have that in check?
Well, empathy goes alongside compassion. Yes, and sad to say, we don't get empathy from healthcare providers. And this is, it's a chain cause effect. Because on the one hand, these healthcare providers are burdened and they are stressed. And as a result, they snap. And so you're going for treatment, you are ill, a healthcare provider is tired after working for hours. And how do you expect to get the empathy required? He is stressed and he can't provide that empathy. It's a duty for him to provide such empathy and to treat with compassion, because all patients have the right to dignity and respect. So in that instance, it just goes to, I think, the best thing to do to ensure that empathy is shown to patients by healthcare providers is for them to educate these practitioners. Tell them that empathy is at the core of medical services, because these patients are there because they need care. And if you're not providing that care without empathy, despair sets in. And the patient can become even worse than how he came into the hospital. So I think it's a big work to be done, sensitization of healthcare practitioners, all around, doctors, nurses, the staffs, they all need to be trained properly so that empathy can be shown in the best attainable way to patients.
Well, according to a particular statistics, that we have 42.8% to 89.8% of medical errors are reported in our healthcare system here in Nigeria. How can we make sure that those numbers are reduced when it comes to, the staffing, that is the medical practitioners, when it comes to the facility, the infrastructure, the equipment, and services provided as well? How can we make sure that that number is reduced? Because with that medical errors, that's an increase in a mortality rate as well.
Yeah, so it has to start from the top and go down. Now, we hardly have medical practitioners. You are aware of the Japa syndrome?
Yes,
Yes.
brain drain.
Yes. And so we have a paucity of medical hands in the country. And as a result, because these doctors are overworked, I think the ratio at the point was 1 to 100. It keeps increasing.
Yes.
Maybe 150 or 200. And how can you expect a doctor to treat up to 150 patients a day?
I believe at this point it's more than that. I think it's 100 to up to 400, I think.
You can imagine.
Yes.
You can just imagine.
So the ratio, doctor-patient ratio, is not agreeable to the medical practitioners as well.
At all. And so imagine a doctor seeing those number of patients and you expect him to have the same standard of care and degree of care for those 400 patients. It's impossible. Fatigue, burnout. You can't really do your work the way it should be. Well, true for a fact, there are cases of medical negligence, blatant medical negligence. And in such cases, the Medical and Dental Practitioner Council, of Nigeria, have also entertained petitions against these medical professionals.
But then is anything done about, those negligence that are blatant, as you said?
Well, of course. I think the Medical and Dental Practitioners Tribunal is active. Now, the Medical and Dental Practitioners Tribunal will not on its own bring cases before itself. And so if patients who have been treated negligently and as a result suffer harm approach this tribunal, they will take it up against the medical practitioner. And he could either be suspended for a period of 6 months, or he could have his name struck off the medical register, and he will not practice medicine as a medical practitioner anymore.
So what you're saying is there isn't a particular, monitoring body that monitors what goes on and what the medical practitioners do, but then the only body that is there is a body that can take action when a negligence case is being put in front of them.
No, of course. These there are regular checks, right? There are regular checks on the medical practitioners by the Medical Council of Nigeria, and they also have in-house resolution of these cases.
Okay.
Yes. So these hospitals are mandated to have complaint mechanisms, and they also can deal with issues, even starting from the hospital. Yes, before the patients take it up, if they will take it up.
But then, we would have to look at this from different angles.
Yeah.
Are we talking about private, hospitals or medical facilities or government facilities? Because at the end of the day, when you look at other hospitals in especially rural areas, primary health cares and things like that, you would see there isn't any proper mechanism put in place for them to put forth their grievances.
Yes, and that is why the Medical and Dental Council needs to carry out a check on these facilities. The National Health Act mandates hospitals to have those mechanisms, right? Now, it behoves on the Federal Ministry of Health, either at the federal or state level, or even at the local government level, to carry out constant checks on these facilities. Now, there are many things that don't go right. It's mandated that hospitals, for example, provide the scope of their practice visible to patients. They are also supposed to actually provide for these complaint mechanisms. For example, they could paste a board outside for patients to even know their rights. They are mandated to do that. Yes, patients know their rights. They tell patients, it just in the form of a notice outside the hospital premises or within the hospital premises, but somewhere that is conspicuously, available to patients. Yeah.
Okay. All right. With these complaints, what aspect do you believe has had a higher rate of neglect when it comes to healthcare in Nigeria? Especially when it comes to, are there mechanisms in place that helps in training and retraining medical practitioners so that they are on the straight and narrow, making sure that their medical assistance is on the tip top?
Yes. There's what they call continuing education for medical practitioners. It's a continuous thing. It's continuous education for them so that they are updated as well as regards the ethical issues involved in their practice. And so it's just to fuse in these duties and their obligations and make sure that these people are properly trained continuously so that the issues of empathy, compassion are ingrained in them, and so that they carry out or give out these medical services in such a way as to minimize medical negligence while prioritizing the dignity of patients. Yes.
All right. But in what particular way directly do you think the Nigerian government should do in addressing the systematic issue? Because these things have been going on for so long, and it's as if it's not being, they're not trying to nip it from the bud. So what do you think the Nigerian government should do in addressing the issue in the healthcare sector?
Well, first of all, provide an enabling environment, provide up-to-date medical facilities, remunerate these medical practitioners such that they feel comfortable staying here in Nigeria and working. Just create an enabling environment. Prioritize their welfare. Give them good pays, commensurate with their practice. And then provide the facilities. It's just like going to a farm without farm implements. To be honest, what are you really going to do? And in such situations, these medical practitioners are helpless. You hear stories that we don't have this equipment, there are no bed spaces, we cannot admit. How do you force these patients on a medical facility that doesn't even have bed spaces? And it's, like I said, it's a chain effect. And as such, if the government can actually do this, treat the medical practitioners well, remunerate them well, provide up-to-date health facilities, and I think there will be much improvement. And educate them as well as educate the masses on their rights and obligations.
All right. But when it comes to, the patients, what healthcare policies do you think especially ones that are in play now and ones that could be put in place that could benefit the everyday Nigerian?
One thing I've come to know is there are no there are no lack of policies in this country. There are policies.
But which of them, when implemented, would benefit the everyday Nigerian properly and shape, the healthcare system and provision of healthcare in Nigeria in a positive light?
Okay. I would say the duty of the government to actually provide healthcare facilities. The Constitution provides in Chapter 2, they talked about the federal government, the state government actually making provisions that will benefit the citizens of the country. Now, if the government takes it seriously and make sure that healthcare is accessible, best medical care is accessible to citizens of the country, whether irrespective of their gender, their socioeconomic status, their religion, their political affiliation, anything at all. If the government can do that and ensure that the policies setting in place to provide these healthcare facilities and healthcare, then I think the cases of medical negligence will drastically reduce. Not forgetting also the continuous education of these medical practitioners as regards their obligations and how they can keep up to international best practices.
So what do you think about healthcare insurance and its implementation in Nigeria, due to the fact that there are lots of people that are not willing to, participate in registering with a healthcare insurance scheme or have, the funds to be able to first be initiated in a healthcare scheme?
Yeah, for government workers, they have the NHIS, National Health Insurance Scheme. Yes, and what it does for them is to reduce the cost of medications to the barest minimum. However, you can't say the same for those who work in the private sector. Okay? So I don't even think most people are aware of health insurance schemes for people in the private sector. People are hardly aware.
All right.
Yeah, so just make the awareness and also make it such that these people can be able to afford these insurance scheme. Yes.
All right. Thank you very much for being here, for joining us, Mr. Ogaga Ediru. It was an absolute pleasure and shining more light on this particular issue. But unfortunately, we would have to end this segment. Make sure, first off, to stay informed, know your rights, whatever it is, know your rights, so that you can stand on your feet and make sure everything goes as it's supposed to.